I will tell you about histopathological features of radicular cyst. This I am going to cover in two lectures. Now today we will study about basic features of radicular cyst histopathology. Now to begin with, to confirm the diagnosis, excisional biopsy is done. Usually whole of the lesion is removed. Now the cyst contains contents which are in the cavity, then there is a capsule, and then there is epithelium. If, if this epithelium is seen, then it's a true cyst. Now, in case of radicular cyst, this cavity contains contents which are watery, straw colored, and it has got protein. This protein is usually eosinophilic. Then, sometimes shimmer like appearance is seen, which is due to cholesterol content. Now, after surgical removal, usually under microscope we study capsule and epithelium. Now, capsule, we all know it is the covering of the cyst, and epithelium is a feature. The different types of epithelium can these are seen in different types of cysts. Now, epithelium will determine which type of cyst is seen. So, in case of radicular cyst, there is a typical epithelium which is rather characteristic. So, number one, epithelium is usually stratified and it is squamous type. Very rarely, pseudostratified ciliated epithelium is seen. It is seen in those cysts which are common in posterior maxilla. Number two, we have to remember the thickness of this epithelium is varied. It is quite thick and prominent than developmental cysts. The cell layers are varied in number. Around 50 to 50 layer cell thickness is seen. Number three, which we have to remember, is that ortho or parakeratinized lining is seen. Number four, sometimes typical ratty ridges are seen, which are not characteristic, but they are usually seen. So, this is the epithelium, and what we are seeing is that in this epithelium, we are seeing unusual, sometimes unusual proliferation of cells. The cells are proliferated more in some areas. This unusual proliferation leads to arcading pattern. arcading pattern of epithelium. Sometimes excretory cells or ciliated cells are found in this epithelial lining. Now coming to part 2, that is capsule. We all know that capsule is the other important component of the cyst. Now the capsule is fibrous. It contains lot of parallel bundles of collagen fibers. Various cells are seen, usually mast cells, satellite microcysts, chronic inflammatory cells, macrophages, lymph or lymphocytes are seen. Sometimes acute inflammatory cells are seen, particularly when epithelium is proliferating. Thank you.